Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is December 10, 2025. This video is on a JAMA article published online about a month ago, November 10, 2025, titled Metabolic Dysfunction Associated Steatotic Liver Disease in Adults, a review. An article with a similar title was published in the New England Journal of Medicine recently. What is MASLD? MASLD is metabolic dysfunction associated steatotic liver disease, the most common chronic liver disease worldwide. What are the key metabolic risks? Obesity, insulin resistance, type 2 diabetes, high blood pressure, and dyslipidemia. How is MASLD diagnosed? Detection of hepatic steatosis plus one or more metabolic syndrome features, excluding excess alcohol or other causes. What imaging is first line? Abdominal ultrasonography with 80 to 89% sensitivity for moderate to severe steatosis. What is MASH? MASH is MASLD with inflammation and hepatocellular injury. How is fibrosis staged? Using biopsy F0 to F4 or non-invasive tests like FIB4, ELF, or elastography. What is the FIB4 index? It's a score using age, liver enzymes AST and ALT, and platelets to assess the risk of advanced fibrosis. When should patients be referred? When the liver stiffness is greater than 8 kilopascals or ELF is greater than 9.8, refer to hepatology. What lifestyle changes help? 7 to 10% weight loss, a Mediterranean diet, 150 minutes of exercise every week, and avoidance of alcohol. What drugs are FDA approved? Resmetirom and semaglutide for adults with MASH and moderate advanced fibrosis. Does weight loss reverse fibrosis? A greater than 10% weight loss improves steatosis, MASH resolution, and regression of fibrosis. What's the role of bariatric surgery? In patients with the BMI greater than 35, surgery reduces MASH and fibrosis and improves long-term outcomes. What complications occur for MASLD? Cirrhosis, hepatic decompensation, hepatocellular carcinoma, cardiovascular disease, and cancer. Who should be screened? Diabetics, obese patients, those with greater than 2 or more metabolic risks, or imaging detected steatosis. What is prognosis based upon? The severity of fibrosis is the strongest predictor of liver-related and overall mortality. What extrahepatic risks exist? High risk of heart failure, chronic kidney disease, atrial fibrillation, and certain cancers. How fast does MASLD progress? Average 1 fibrosis stage per 7 years in MASH and per 14 years in isolated steatosis. What future therapies are coming? Incretin polyagonists, FGF21 analogs, and PPAR agonists are under investigation. Can ALT be normal? Does the liver enzyme be normal? Yes, up to 2/3 of MASLD patients have normal aminotransferase levels. Does alcohol interact with MASLD? Moderate alcohol plus metabolic dysfunction increases the progression of liver disease. This is in a nutshell. Read the article in JAMA. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.